I had to tell my husband. Then my children. I had to explain why I was going to the doctor so often. It was humiliating. It was exhausting. By the end of March 2013, officials reached a conclusion that stunned the public. More than 7,000 patients who had been treated at the clinic over decades would need to be notified and tested. It began like any other day in Tulsa, Oklahoma. A quiet suburban dental clinic sat on the corner of a busy street, its waiting room filled with parents, children, and the occasional elderly patient flipping through magazines. The clinic had been there for decades. To the community, it was familiar, unremarkable even. Patients came in for checkups, root canals, tooth extractions, or just a routine cleaning. No one thought twice about sitting in the chair, leaning back, and trusting the dentist to do his work. That trust, the silent agreement between patient and professional, is at the heart of medicine. You open your mouth, close your eyes, and let someone with sharp instruments work inside your body. You don't question whether the tools are clean. You don't ask how many times a syringe has been used. You don't check expiration dates on medications. You simply trust. But in 2013, this very clinic became the center of one of the largest patient notifications in American history. More than 7,000 people received letters warning that they might have been exposed to hepatitis B, hepatitis C, or even HIV, simply because they had trusted their dentist. When inspectors finally stepped inside, what they found shocked even seasoned professionals. Rust-stained instruments, medication vials used again and again on different patients, sterilization logs incomplete, sometimes missing entirely. Assistants performing procedures they weren't licensed to do. It was a clinic that had quietly operated for decades. And yet, beneath the surface, it was breaking the most basic rules of safety. This was not just a mistake. This was systemic negligence, hidden behind the appearance of routine care, and the consequences would ripple far beyond the walls of that small Tulsa office. My name is Rumi Blake. I work around medicine, and over the years, I've come across stories that don't make the headlines. Stories whispered in hallways, buried in inspection reports, or passed quietly from one professional to another. I tell these stories because they matter. They reveal how fragile trust in healthcare can be, and how quickly it can be broken when oversight fails. You'll notice that I appear only as a silhouette. That's deliberate. These stories aren't about me. They're about the patients who suffered, the staff who stayed silent, and the inspectors who finally uncovered the truth. And sometimes protecting those who shared their experiences means protecting my own identity as well. That's why I speak from the shadows, not to hide, but to focus on the story itself. Tonight, I want to take you inside the Tulsa dentist scandal. We'll walk through what inspectors discovered behind those clinic doors, what patients were told after years of silence, and what staff admitted when the investigation began. We'll explore why oversight failed and how a single office managed to expose thousands to risks no one should face in modern medicine. Because this wasn't just about one dentist. It was about the entire system. The cracks that allowed this to happen, the voices that went unheard, and the cost of ignoring the simplest rules of patient safety. This is not a comfortable story, but it's one that needs to be told. The first signs of trouble didn't come from inspectors or from patients. They came from the people who worked inside the clinic every day: assistants, hygienists, and front desk staff. People who knew the rhythm of the office, the way the chairs stayed full, the schedule packed from morning until late afternoon. People who noticed things but didn't always feel safe speaking up. When I started looking into this case, I heard from one former staff member who asked me not to use her name. She told me that, for years, she worried about how instruments were handled. She remembered opening trays that still showed rust. She remembered looking at suction tips that were supposed to be single-use but were set aside to be used again. And she remembered the quiet pressure that came from above. Keep moving, keep the patient cycling through, don't fall behind. In many medical settings, there's a pressure that never gets talked about openly, the pressure of volume. More patients means more income. And when profit is measured by how many chairs are filled each day, safety can become secondary. Inside this clinic, staff described a culture where time spent carefully sterilizing instruments was seen as a delay. If you slowed down the flow, you were slowing down the money. One assistant explained it to me this way. We didn't have enough sets of instruments to rotate properly. So instead of waiting for a full cycle in the sterilizer, we sometimes just wipe things down and use them again. Everyone knew it wasn't right, but no one wanted to lose their job by saying too much. That sentence stayed with me because it shows the quiet calculations so many staff members make in environments where corners are cut. Speak up and risk your job, or stay silent and keep your paycheck. Rust on dental instruments isn't just cosmetic. It's a sign that metal has been compromised, that sterilization might not be working properly, and that tiny crevices can harbor pathogens. One hygienist later told investigators that she had seen rust many times on the tools she was asked to use. Sometimes she would set an instrument aside, hoping someone else would deal with it. Sometimes she would clean it quickly and use it anyway, because there was a patient already waiting in the chair. When I asked how often this happened, she paused. Finally, she said, "Often enough that it stopped surprising me." The inspection report that eventually became public described the use of multi-dose vials for multiple patients. That practice is dangerous. Every time a syringe enters a vial, there is a risk of contamination. And once a contaminated vial is used again, the risk spreads to every patient who receives it. A former staff member confirmed to me that syringes were not always disposed of after a single use. Sometimes, in an effort to conserve supplies, syringes were used across multiple patients, especially during busy clinic days when sedation was being given. She told me, "We knew it was wrong, but it was explained as being efficient." That word, efficient, came up a lot. Another issue that surfaced later was the role of dental assistants in the clinic. In Oklahoma, as in most states, only licensed professionals can administer certain kinds of sedation. But in this office, inspectors found that unlicensed assistants were involved in tasks they were not qualified for. One assistant, speaking off the record, admitted, "We were asked to do things we weren't trained for." 4 lines, medication prep. I knew it wasn't legal, but the expectation was that you just figure it out. Think about that. Untrained staff, handling drugs, setting up IV sedation, in a setting where even the sterilization of instruments was in question. The natural question is, why didn't anyone speak up sooner? The answer is complicated. Fear of losing a job, belief that regulators wouldn't listen, and a sense that this is just how things are done here. When unsafe practices become routine, they stop feeling like violations, and when they become normalized, part of the workflow. One staff member summed it up. After a while, you stop seeing it as dangerous. You just see it as the way this office works. Most patients never noticed. They sat in the chair, chatted with the dentist, and left without realizing what was happening behind the scenes. A few remembered odd details later. A syringe that didn't look fresh, a tray that didn't feel as clean as it should. But no one thought it added up to a systemic risk. No one imagined that the very tools used on them could carry blood-borne pathogens from another patient. Trust is a powerful thing, and in this office, trust was being quietly violated day after day. By the time inspectors finally walked through the doors, the problems were already years old. Rust didn't appear overnight. Sterilization logs don't suddenly vanish. These were issues that had been building slowly, tolerated in silence, ignored for convenience. And that silence set the stage for what would become a national scandal. This is where the story shifts, because soon, one patient's test result would force regulators to look more closely. And when they did, they uncovered a level of risk that shocked even them. But inside the clinic, the whispers had been there all along. Staff who saw, staff who worried, staff who chose silence. In medicine, silence can be deadly. For years, the problems inside the clinic remained invisible. Rust on instruments, reused vials, unlicensed assistants, all hidden behind the daily routine of dental care. And for years, patients trusted. They leaned back in the chair, opened their mouths, and assumed safety. But then came the moment that cracked the silence. In early 2013, a patient from Tulsa tested positive for hepatitis C. For that patient, the diagnosis was devastating. Hepatitis C is not a trivial infection. It attacks the liver. It can remain silent for years before causing serious damage. And it carries with it not only medical consequences, but stigma. The patient began asking questions. How did this happen? Where had it come from? They weren't someone who fit the typical risk profile. No drug use, no recent transfusions, no obvious exposures. And as the patient's history was traced back, one detail stood out. They had received treatment at the same Tulsa dental clinic that so many others had visited for decades. When the local health department was notified, it wasn't just another case on paper. There was something unusual about the circumstances, something that suggested this infection might not have come from chance. A small team of investigators began looking closer. They interviewed the patient, they reviewed medical records, and the more they looked, the more one possibility began to take shape. The clinic itself might have been the source. Public health officials don't make that conclusion lightly. Suggesting that a healthcare facility is spreading bloodborne pathogens is serious. But the clues were strong enough that the Oklahoma State Department of Health decided they had no choice but to act. What came next was extraordinary. The health department assembled a team, including inspectors and infection control experts, and scheduled an unannounced visit to the Tulsa clinic. When I later read portions of the inspection file, one line stood out. It said the purpose of the visit was to assess infection control practices due to potential patient exposure. Those words might sound technical, but in practice they meant one thing. Inspectors suspected that the clinic itself might be infecting patients. For the staff inside the office, that day began like any other. They prepared trays, checked appointments, and greeted patients. They had no idea that in just a few hours, inspectors would be stepping through the doors to look into every corner of their work. The initial walkthrough told inspectors almost everything they needed to know. Sterilization logs incomplete, medication vials stored improperly, unlicensed staff preparing sedation, rust visible on tools that should have been pristine. One inspector later described the scene as deeply concerning. That phrase may sound restrained, but in inspection language, it signals a crisis. As they documented each violation, the scope of the risk became clearer. This wasn't about a single patient. This was about thousands. News of the inspection quickly reached the state health department leadership. What had begun as a single hepatitis C case was now recognized as something much larger. It wasn't just possible that other patients had been exposed, it was likely. The decision was made to expand the investigation. Records from the clinic were pulled, medication lots were reviewed, and contact tracing began. By the end of March 2013, officials reached a conclusion that stunned the public. More than 7,000 patients who had been treated at the clinic over decades would need to be notified and tested. On March 28, 2013, the Oklahoma State Department of Health and the Tulsa Health Department held a joint press conference. They announced that any patient who had received dental care at the clinic from 2007 onward should be tested for hepatitis B, hepatitis C, and HIV. It was one of the largest patient notification efforts in U.S. history. The room was filled with reporters, cameras clicking, microphones held forward. Behind the official statements, though, there was something else, a quiet acknowledgement that the system had failed. A single patient's diagnosis had pulled back the curtain. And behind it, officials found years of unsafe practices that had gone unnoticed. In medicine, we often talk about sentinel events, the one case that exposes a deeper danger. For Tulsa, this patient was that sentinel. Their diagnosis forced inspectors through the door, and once inside, they discovered a level of risk that would change thousands of lives. The trigger had been pulled. Now the full scandal would come to light. The inspectors arrived quietly. There were no flashing lights, no news crews waiting outside, just a small team of professionals carrying clipboards and cameras, prepared to evaluate what was happening inside one dental office in Tulsa, Oklahoma. To the patients sitting in the waiting room that morning, nothing seemed unusual. But once the inspectors stepped into the back, into the sterilization area, into the storage rooms, the truth began to reveal itself. One of the first things inspectors checked were the trays of dental instruments. At a glance, they saw what staff had whispered about for years: visible rust and debris, scalers, probes, suction tips. Tools that should have been spotless showed signs of corrosion. Rust isn't just a cosmetic flaw. It means the surface of the instrument is compromised. It means microorganisms can find small crevices to hide in. It means sterilization may not work the way it's supposed to. One inspector wrote in the report, "Instruments observed with brownish discoloration and visible pitting." That kind of language, in inspection terms, is devastating. Next, they turned to the sterilization machines, the autoclaves. These machines are supposed to run at high pressure and temperature, killing any bacteria, viruses, or spores left on instruments. But when inspectors opened the logs, they found entire weeks missing. Some cycles had not been recorded. Others had no documentation of whether they had reached the proper temperature. And in some cases, there were no logs at all. One inspector later described it as an absence of accountability. Without those records, there was no way to prove that instruments had ever been sterilized properly. Then came the discovery that changed everything: the way medications were stored and used. Inspectors observed open, multi-dose vials that had been accessed multiple times with the same syringe. This is one of the most basic violations of infection control. Every time a used syringe enters a vial, there is a risk of contaminating the entire supply. If that vial is then used again, the risk spreads to every patient who receives it afterward. In this clinic, inspectors found multiple vials that had been punctured repeatedly. They also documented syringes stored in a way that suggested reuse. One note from the inspection file stated, "Evidence of multi-dose vials accessed multiple times with potential cross-contamination." For public health officials, this was the smoking gun. As the inspection continued, another alarming issue came to light. Unlicensed dental assistants were found performing tasks far beyond their training. In Oklahoma, only licensed professionals can administer intravenous sedation. Yet records and observations showed that assistants, not licensed dentists or anesthetists, were preparing medications and assisting with IV administration. One assistant admitted quietly that they had been shown how to do it and told to handle sedation during busy clinic days. They had no formal certification, no legal authority, and no safety net if something went wrong. Inspectors describe this as a direct risk to patient safety. In any clinic that offers sedation, there must be emergency drug kits on hand, medications that can reverse sedation or stabilize a patient in crisis. Inspectors opened the kits and found expired drugs. Some had expired months earlier, others years. One of the inspectors later commented that this discovery left them shaken. If a patient had gone into respiratory distress during sedation, the very drugs meant to save them might not have worked. By the end of the inspection, the picture was clear. This was not a clinic that had simply made a mistake. It was a clinic operating with systemic disregard for basic infection control. The final report included words rarely seen in official documents. Practices observed pose a serious risk of harm to patients. In inspection language, that's as close to an alarm bell as it gets. For the inspectors, walking out of that clinic, the gravity of the situation began to sink in. This wasn't about one patient. It wasn't about 10. This was about thousands of people who had sat in those chairs over the years, never knowing what was happening behind the scenes. Each rusted tool, each reused syringe, each expired vial represented a potential exposure. And the only responsible step left was clear: notify every patient who might have been at risk. The inspection was supposed to answer a question. Instead, it opened the door to one of the largest patient notifications in American history. By the time officials finished reviewing their notes, the number was staggering. More than 7,000 people would need to be contacted, tested, and told the unthinkable, that their trust in a simple dental visit might have exposed them to life-changing diseases. The scandal was no longer contained to a single clinic. It was about to spill into the homes of thousands of families across Tulsa. The inspectors had their evidence: rust on instruments, expired medications, unlicensed sedation, and syringes reused across patients. But evidence inside the clinic was only half the story. The next step was to calculate the damage, to figure out how many people might have been exposed. Public health officials began by reviewing patient records from the clinic, every appointment log, every billing entry, every chart that still existed. The records stretched back for decades, tens of thousands of visits, hundreds of patients each year, but the focus had to be narrowed. Regulators decided to go back at least 6 years, to 2007, when the documentation was more complete and still accessible. From those records, they pulled names, one by one, line by line. When the final count came in, the number shocked even the officials themselves. More than 7,000 patients had received treatment at the clinic during that time, and each one of them would now have to be told, "You may have been exposed to HIV, hepatitis B, or hepatitis C." Imagine opening your mailbox and finding a letter from the state health department. Inside, it explains that you once sat in a dental chair, maybe years ago, and that visit might have put your health and your family's health at risk. The letters were clinical in their wording, but devastating in their impact. They urged patients to come forward for testing immediately. They listed the infections of concern, and they provided locations where free testing would be offered. One patient who received the letter later said it felt like a bomb dropped in the middle of my kitchen. They had trusted their dentist. Now they were being told that trust might cost them their life. To handle the response, the Tulsa Health Department set up multiple testing locations across the city. Gymnasiums, community centers, and clinics were converted into mass screening sites. Lines formed outside, people clutching letters, waiting for their turn. When I spoke with a public health nurse who helped during those weeks, she described the atmosphere as heavy, tense. Some patients came in quietly, eyes down. Others arrived in tears. Many were angry. The nurse told me, you could feel the fear in the room. People looked around at each other, wondering if the person sitting next to them had the same problem, wondering if they themselves were already infected. Numbers alone don't capture what those days felt like. Behind every number was a person. A mother worried about whether she had unknowingly passed something to her children. A husband terrified of what his wife would say when she learned why he was being tested. A young man, embarrassed and anxious, who had never imagined being tested for HIV in his life. The stigma was powerful. Some feared being judged, even though they had done nothing wrong except go to the dentist. Others feared what a positive test would mean for their future: jobs, insurance, relationships. In the waiting rooms, silence often replaced conversation. Strangers sat side by side, holding the same letter, living the same fear. The story quickly spread beyond Tulsa. National outlets picked it up, framing it as a shocking scandal. A dentist accused of putting thousands at risk. Reporters camped outside the health department. Families interviewed on camera shared their anger and disbelief. But for those inside the testing centers, it wasn't about headlines. It was about blood draws, lab slips, and days of waiting for results. When the first results began to come back, the data confirmed what officials feared. Dozens of patients tested positive for hepatitis B and hepatitis C. At least one tested positive for HIV. The percentages might have looked small on paper compared to the thousands tested, but each positive result represented a life altered forever. And beyond the infections confirmed, there was another number, harder to measure. The number of people whose trust in healthcare was shattered. 7,000 is more than a number. It's a community. It's classrooms, workplaces, families. For weeks, Tulsa was consumed by the scandal. Every conversation in coffee shops, churches, and schools seemed to return to one question. Did you get a letter? Some admitted it. Others stayed silent, but everyone knew someone who had been affected. This was the moment the scandal escaped the walls of the clinic and entered the lives of thousands. Inspectors had counted the patients. The health department had sent the letters. and the city of Tulsa was left holding its breath, waiting to learn how deep the damage really went. For some, the tests would come back negative. For others, the results would change everything. And for everyone, the trust that once came so easily, the trust that a dental chair was a safe place, would never be the same again. The letters had gone out. More than 7,000 homes across Tulsa now held a piece of paper that no one ever expects to receive. The instruction was clear. Come in, get tested, find out if you've been exposed. And so the city braced for something it had never seen before, a mass medical testing effort, not for a flu outbreak, not for a foodborne illness, but for infections that should never have been linked to a dentist's office. On the first day, people lined up outside community centers before the doors even opened. Some carried the letters folded in their hands. Others brought their children, worried that family members might also need to be tested. Health officials had set up stations, registration desks, blood draw areas, and private rooms for counseling. They were ready for large numbers, but nothing could fully prepare them for the weight of emotion that filled those spaces. One nurse who volunteered told me it wasn't just a line of patience, it was a line of fear. Inside, the mood was hushed. Conversations were short. Many avoided eye contact, not wanting to be recognized by neighbors or coworkers. There was shame in the air, though none of these people had done anything wrong. They had simply gone to the dentist, and now they were sitting in a public testing center, waiting to learn if their lives had been changed forever. Some tried to lighten the mood with nervous jokes. Others sat in silence, staring at the floor. Children tugged at their parents' sleeves, not fully understanding why everyone looked so tense. When their names were called, patients stepped into small booths where nurses prepared the tests. Vials were labeled, blood was drawn, and samples were set aside for laboratory analysis. For most, the process was quick, but the waiting that followed was anything but. Some patients would get results within days. Others would wait longer depending on lab backlogs. And in that waiting period, imaginations ran wild. One man told reporters he didn't sleep for 3 nights after his test. Another said he avoided hugging his children until he knew his status. Fear wasn't confined to the clinics. It spread into kitchens, workplaces, and church pews across the city. Health officials had brought in counselors to help. After patients had their blood drawn, some were offered the chance to sit with trained staff who explained what the tests meant, how the viruses worked, and what a positive result would mean. Those sessions often turned emotional. People cried. Some grew angry. Some asked over and over, "How could this happen at a dentist's office?" The counselors didn't have easy answers. They could explain the science. They could explain the testing, but the deeper question, why oversight had failed, was one they couldn't fully answer. Among the most heartbreaking scenes were the children. Parents brought in teenagers who had braces done at the clinic. Mothers carried toddlers who had received early dental care there. For those parents, the thought that their child could be infected because of something as simple as a dental visit was unbearable. One mother later told a local station, "I was shaking as they drew his blood. I kept thinking, he's too young for this. He should never have to go through this." Within a week, the first wave of results returned. Most patients were negative. But for some, the news was devastating. Dozens tested positive for hepatitis C, others for hepatitis B. At least one case of HIV was confirmed. Those who tested positive were referred to specialists for further evaluation. For them, life would now be divided into before and after the test. The numbers might have seemed small compared to the 7,000 tested, but in human terms, each positive result represented a broken life, a family thrown into crisis. Cameras showed up at some of the testing sites. Reporters tried to capture the emotion, the fear in people's eyes, the tears of parents holding children close. Some patients agreed to interviews, speaking out about their anger and their disbelief. Others refused, preferring to keep their pain private. But whether public or private, the feelings were the same: betrayal, fear, and an overwhelming sense of injustice. For Tulsa, these weeks felt like living in the shadow of a storm. Everyone knew someone who had been called for testing. Everyone was waiting for results. and everyone was asking, how could this have happened? Trust in healthcare had been shaken in a way that would not be repaired easily. The testing centers represented more than a public health response. They were a mirror of what happens when safety fails, when silence allows danger to grow until it touches thousands. Behind every vial of blood was a story. Behind every name on a clipboard was a life on hold. And behind it all was a single clinic whose failures had now become a community's nightmare. The tests provided answers, but they also raised new questions. Questions about the dentist, the staff, and the system that should have stopped this long before a letter landed in anyone's mailbox. For weeks, the city of Tulsa had been waiting. Blood had been drawn, samples shipped to labs, results processed. Now the numbers were ready, and the truth they carried would alter lives forever. When the first reports came in, there was relief for many. The majority of the more than 7,000 patients tested negative. For them, the ordeal ended with a sigh of relief, though not without scars. Even those who tested negative spoke of the sleepless nights, the whispered conversations, the weight of not knowing. But for others, the envelope they received or the phone call they answered changed everything. Dozens of patients tested positive for hepatitis C. Several tested positive for hepatitis B, and at least one tested positive for HIV. Officials tried to frame the numbers carefully, reminding the public that many patients already carried these infections before visiting the clinic. But for those who tested positive and had no other risk factors, the connection was clear. They had trusted a dentist, and in return they had received a lifelong infection. When I spoke with one patient who asked me to keep their name private, they described the moment they got their results as surreal. They had come to the testing center expecting reassurance, not devastation. The nurse delivered the result in a quiet room with a counselor present. The patient told me, "I didn't even cry at first. I just sat there, staring. I kept saying, 'This can't be real. This can't be from my dentist.'" It was only later, in the car on the drive home, that the tears came. For families, the news was even more complex. One woman who tested positive for hepatitis C said her first thought wasn't about herself, but about her children. Had she unknowingly exposed them? Would they grow up seeing their mother as infected? Another patient feared telling their spouse, terrified that the marriage might not survive the stigma. Infection didn't just affect the body. It touched every relationship, every corner of life. As results became public, lawyers began filing cases. Patients who had tested positive demanded accountability. Families who lived through weeks of fear wanted justice. Multiple lawsuits alleged negligence, unsafe practices, and failure to protect patients. The legal process was slow, but it added another layer to the scandal. The idea that the courts would now have to decide what this dentist owed to the thousands who had trusted him. By this time, the dentist at the center of the scandal had voluntarily surrendered his license. He never practiced again. But for many, surrendering a license felt like too little, too late. Lives had already been changed. No professional penalty could erase that. In Tulsa, the story dominated conversation for months. Every confirmed infection carried a ripple effect. Neighbors whispered. Church congregations offered support. Families wrestled with shame, anger, and grief. And though officials assured the public that the risk was now contained, the damage to trust was immeasurable. Doctors and dentists across the state watched the scandal unfold with a mix of outrage and fear. Outrage that one of their own could disregard safety so recklessly. Fear that the scandal would stain the reputation of every professional, making patients hesitant to trust again. Some clinics reported cancellations. Others fielded anxious calls from patients who asked, sometimes bluntly, "Are your instruments really clean?" On paper, the numbers were simple. Thousands tested, dozens infected. One HIV case confirmed. But behind those numbers were lives. Behind every positive test was a person who would now live with a virus they had never expected, a burden they should never have carried. Statistics may tell the scale, but they cannot tell the weight of betrayal. The results confirmed what inspectors had feared. The Tulsa Dental Clinic had not just broken rules, it had broken lives. For those who tested positive, there was no undoing the exposure. For those who tested negative, the relief was real but incomplete. because once trust is broken, even a clean test cannot restore it fully. And for the city of Tulsa, the scandal had become more than a news story. It was a wound, one that would take years to heal. By the time inspectors completed their initial walkthrough, the evidence of poor sterilization was already damning. But the deeper they dug, the more they realized this was not just a story of dirty instruments. This was a clinic where multiple layers of safety, every safeguard patients should be able to count on, had been ignored, bent, or outright broken. One of the most alarming findings was related to sedation. The clinic offered procedures under IV sedation, the kind of care that requires strict oversight and careful monitoring. In Oklahoma, as in most states, only licensed professionals can legally administer sedation. But inspectors discovered that unlicensed dental assistants were preparing and assisting with IV drugs. Assistants, who had no authority and no training, were tasked with jobs that should have been performed only by certified professionals. One assistant later admitted, off the record, "We were shown how to do it. We knew we weren't supposed to, but that's how the office worked. If the dentist said do it, you did it." This wasn't just cutting corners. It was putting patients' lives in danger every time sedation was used. Another safeguard every clinic is required to maintain is an emergency drug kit, life-saving medications that can reverse sedation or stabilize a patient in crisis. Inspectors opened the kits and found expired drugs, some out of date by months, others by years. Medications meant to save lives in emergencies were essentially useless. Imagine if a patient had gone into respiratory arrest in that clinic. The drugs meant to bring them back might not have worked at all. For inspectors, this was one of the most chilling discoveries. It wasn't just about infection control anymore. It was about the possibility that a patient could have died in that chair, not from disease, but from a lack of preparedness. As the investigation widened, officials reviewed how the clinic managed controlled substances, medications that require strict record-keeping under federal law. What they found raised even more questions. Logs were incomplete. Some vials were unaccounted for. There were discrepancies between what was ordered and what was documented as used. In other words, no one could say with certainty where every dose had gone. Was it all used on patients? Was some diverted? The record simply didn't say. For a medical office, that kind of gap isn't just sloppy, it's a violation of federal law. Taken together, the findings painted a disturbing picture. Instruments not properly sterilized. Syringes and vials reused across patients. Unlicensed staff administering sedation. Expired emergency drugs sitting in the crash kit. Controlled substances poorly tracked. It wasn't one mistake, it wasn't one bad day, it was an entire system of neglect, built up over years, normalized by silence, and hidden behind the mask of routine dental care. Inspectors are trained to stay calm, professional, detached. But in interviews later, some admitted that what they saw in Tulsa was among the worst they had ever encountered. One described it as a cascade of risk. Every safeguard that should have protected patients had failed at once. And when multiple safeguards fail, disaster is inevitable. It would be easy to see this case as unique, as one bad actor in one office, but the truth is more troubling. Because every system that should have caught the violations, state boards, oversight agencies, even professional peers, had missed it. For decades, patients came and went, and only when infections began to surface did anyone look closely enough to see the rot beneath. Beyond sterilization, the Tulsa dentist scandal revealed something deeper. That safety in healthcare is never guaranteed simply because a license hangs on the wall. It requires constant vigilance, constant accountability. And when those things are absent, even the most ordinary clinic can become a place of extraordinary risk. The next chapter would show just how far those failures reached, into the very system meant to protect patients in the first place. When the Tulsa scandal broke, many people asked the same question. How could this go on for so long without anyone noticing? It's the question that hung in the air at testing sites. It was whispered in homes across the city. And it's the question that health officials struggled to answer. Because on paper, the system should have caught this. But in reality, the oversight that was supposed to protect patients simply wasn't there. In the U.S., hospitals, surgical centers, and nursing homes are subject to regular inspections. They are large, complex facilities with dozens or even hundreds of staff. The assumption is that the risk of systemic problems is higher, so regulators keep a close eye on them. Dental clinics, by contrast, are often small, privately owned practices. In many states, including Oklahoma, routine inspections are rare. Unless a complaint is filed or an incident reported, a dental office might go decades without anyone from the outside checking its practices. That gap is exactly where the Tulsa clinic hid. Oversight often relies on complaints. A patient notices something unusual. A staff member sees a violation. They file a report with the state board or the health department. But complaints come with risk. Patients may not realize what they saw. Staff fear losing their jobs if they speak up. And sometimes complaints are dismissed as isolated or exaggerated. In this case, staff later admitted that they had concerns for years, but the fear of retaliation kept them silent. Without a complaint, the regulators never came. The Oklahoma Board of Dentistry had authority over the dentist's license, but license renewal is largely a paperwork exercise. As long as fees are paid and continuing education requirements are logged, licenses are often renewed automatically. Board investigations usually begin only after a formal complaint, and until 2013, there had been none that led to a full-scale inspection of this office. So, year after year, the license was renewed, and year after year, the risks grew unchecked. There were other loopholes, too. For example, sedation practices. While rules stated that only licensed professionals could administer IV sedation, enforcement was lax. Unless someone reported a violation, regulators had no way of knowing who was handling drugs behind clinic doors. Controlled substance records? The Federal Drug Enforcement Administration has authority, but its focus is often on large-scale diversion, not small clinics. Unless a pharmacy flagged unusual orders, a dentist's office could easily slip under the radar. Even infection control, something as basic as sterilizing instruments, had no external oversight in dental clinics unless an inspection was triggered. What the Tulsa case revealed most clearly is that oversight in dentistry is reactive, not proactive. Agencies step in only after a problem is reported, not to prevent problems in the first place. In medicine, prevention is everything. But in regulation, prevention often takes a backseat to efficiency and limited resources. One public health official later admitted, "We don't have the staff to walk into every dental office in the state. We rely on complaints to guide us. That reliance cost Tulsa thousands of patients their peace of mind, and some their health." Another layer of failure came from professional peers. Dentists in the area had likely heard rumors. Some may have even seen signs that the clinic was cutting corners. But in professional communities, speaking out against a colleague is rare. It feels disloyal, it risks backlash. And so, silence becomes the norm. In Tulsa, that silence helped shield the clinic for decades. By the time inspectors finally stepped through the doors, the damage was already done. Thousands of patients had been exposed to risk. Dozens had been infected. And the trust of an entire community had been shattered. The oversight system had worked, but only after the harm had already spread. The Tulsa scandal wasn't just a failure of one dentist. It was a failure of oversight itself, a reminder that safety isn't guaranteed just because rules exist on paper. For patients, the lesson was painful. Licenses on the wall don't always mean safety behind the door. And for regulators, the case became a symbol of the need for stronger, proactive checks. Because once harm is done, no inspection can undo it. For weeks, the city of Tulsa had spoken about the scandal in broad terms. The clinic, the testing, the letters. But behind every institution is a person. And in this case, that person was the dentist whose name appeared on the license, the prescription pads, and the sign outside the building. Before 2013, he was seen as a respected member of the community. He had practiced for decades, long enough to treat generations of families. Some patients described him as quiet, professional, almost routine in his manner. Others remembered him as distant, rarely engaging in long conversation, always moving quickly from chair to chair. No one imagined that behind that routine was a system of shortcuts and violations. To the public, he was simply the dentist down the road. He had been licensed in Oklahoma for years, with no major disciplinary actions on record before the scandal. Each year, his license was renewed. He took continuing education courses, submitted paperwork, paid fees, the standard process for staying in good standing. And yet, during those same years, the practices inside his office drifted further from the standards of safety. How much of that drift he knew about personally, and how much he allowed to happen under his watch, became the central question. But either way, as the licensed dentist in charge, responsibility fell on his shoulders. When inspectors interviewed staff, some described him as a figure who set the tone of the clinic. If he wanted things done quickly, they were done quickly. If he chose to overlook safety, everyone else understood that speaking up could mean losing their job. One assistant put it plainly, it wasn't that he didn't know. It was that he didn't care. Patients were numbers, and the goal was to keep the chairs full. Others defended him, insisting he trusted staff too much and may not have realized how unsafe things had become. But in medicine, ignorance is not an excuse. The law is clear. The license holder is responsible for everything that happens under their roof. When the scandal broke, the dentist quickly surrendered his license. There was no drawn-out disciplinary hearing, no attempt to fight regulators in court. He gave it up voluntarily, effectively ending his career overnight. For some, that act seemed like an admission. For others, it was seen as a way to avoid further scrutiny. Without a license, there was no longer a case to investigate in the same way. The man at the center of the storm stepped quietly out of the profession, leaving behind patients, staff, and a community still reeling. What frustrated many was the lack of explanation. He never stood in front of cameras, he never issued a detailed public statement, and so the most basic questions remained unanswered. Did he know how unsafe the clinic was? Did he deliberately cut corners to save money? Or did he simply look the other way as problems piled up? Without those answers, speculation filled the silence. Some painted him as careless, even reckless. Others as overwhelmed, perhaps out of touch with modern practices. The truth may never be fully known, or be. For patients who had once trusted him, the scandal was personal. Some said they felt betrayed. Others said they couldn't reconcile the man they remembered, gentle, professional, with the violations described in inspection reports. The clinic doors eventually closed. The sign with his name was taken down. But in conversations around Tulsa, his name became shorthand for a breach of trust that would not be forgotten. In the end, the dentist was not just a figure at the center of a scandal. He became a symbol of how even a long, seemingly respectable career can collapse under the weight of neglect. For decades, patients trusted him with their health, and in the silence of his office, that trust was broken. Whether through intention or indifference, the result was the same. Lives changed, faith in healthcare shaken, and a career erased in a single scandal. When the story of the Tulsa clinic broke, statistics dominated the headlines. 7,000 patients notified, dozens infected with hepatitis, at least one case of HIV, but behind every number was a human being, a person with a name, a family, a life that had been disrupted in ways no inspection report could fully describe. One patient I spoke to asked that I keep their identity private. They had gone to the clinic for a simple extraction years earlier. When the letter arrived, they said their hands shook so badly they could barely open the envelope. Inside were words no patient ever expects to read. You may have been exposed to bloodborne pathogens. They told me, I thought it had to be a mistake. How could a dentist's office do something like this? But when I went for testing, I realized it was real. I sat in that chair. I let them use those instruments, and now I'll never look at medical care the same way again. For those whose results came back positive, the experience was life-changing. One man who tested positive for hepatitis C described the moment as a kind of exile. The nurse told me gently, but all I could hear was the word positive. I felt like I had been pushed outside my own life, like I was suddenly different, contaminated. He spoke about the stigma, friends who pulled away when they heard, family members who treated him cautiously. The infection wasn't just in his blood, it was in the way people saw him. Another patient, a woman who tested positive for hepatitis B, described the ripple effect on her family. I had to tell my husband. Then my children. I had to explain why I was going to the doctor so often. It was humiliating, it was exhausting, and it all came from a place I trusted. Even those who tested negative carried scars. A mother told me she spent weeks terrified that her child might be infected. Every night she lay awake, imagining what the results might say. When the results finally came back negative, she cried with relief, but also with anger. Why did we have to go through that? Why did my daughter have to be part of this? We were clean, but we'll never forget the fear. A man in his 50s said the same. I wasn't infected, but I'll never sit in a dentist's chair without looking around the room differently. I'll always be watching now, and that kind of trust doesn't come back. The impact wasn't limited to patients. Spouses, children, parents, all felt the weight of the scandal. One young woman whose father tested positive for hepatitis C told me, "It changed our family." He became depressed. He stopped going out. He said he felt dirty. But he wasn't dirty. He was betrayed. For some families, the news drew them closer together. For others, it created fractures that never healed. If one word echoed across every conversation I had, it was betrayal. People trust their dentist. They don't ask about sterilization cycles or expiration dates. They don't check who's preparing sedation. They assume those things are handled. In Tulsa, that assumption was shattered. Patients felt they had been used, neglected, and abandoned by a system that never checked, never questioned, never protected them. One man summed it up bluntly. They didn't just fail us. They lied to us with every appointment, every time they handed us a bill, every time they told us to trust them. For those infected, the story didn't end with a test result. It became a lifelong medical journey. Doctor visits, medications, insurance battles. The constant reminder that their infection came not from risky behavior, but from a place that was supposed to be safe. For others, the consequences were psychological. Every cough, every fever, every moment of fatigue brought back the fear. Even years later, the memory of waiting for results still haunted them. Statistics make scandals easier to summarize, but behind every number was a voice. Behind every infection was a story of trust broken, lives disrupted, and pain that cannot be measured in charts or graphs. The Tulsa scandal wasn't just about disease, it was about betrayal. And for the patients who lived through it, the scars, visible and invisible, would last a lifetime. When the Tulsa scandal finally reached national headlines, reporters wanted to know not only what happened, but what could be done to make sure it never happened again. Officials faced a difficult truth. This case hadn't been a freak accident. It had been a slow-building failure, and one that exposed cracks in the system too big to ignore. Public health leaders in Oklahoma moved quickly to reassure the community. Testing centers were expanded. Helplines were staffed. Counselors were sent to provide emotional support. But beyond the immediate crisis, there was another conversation happening behind closed doors. How do we prevent the next Tulsa? One of the clearest lessons was that dental practices could no longer be assumed safe simply because they were small and privately run. For decades, oversight had been concentrated on hospitals, nursing homes, and large surgical centers. Dental offices slipped through the cracks. They were visited rarely, if at all. The Tulsa case showed that even a single dentist's office could put thousands at risk. It forced regulators to admit what they had long known but seldom said out loud. Oversight was not keeping pace with reality. The scandal also sparked new conversations about infection control in dental offices nationwide. Professional associations issued reminders to dentists across the country. Sterilization logs must be complete. Single-use items must never be reused. Multi-dose vials must not be shared between patients. These reminders were basic, almost elementary, but the fact that they had to be repeated told its own story. The system had grown complacent. Public health experts began pointing out that complacency wasn't unique to Tulsa. Whenever oversight is weak, the same risks exist. All it takes is one office cutting corners, one staff member afraid to speak up, one regulator too overworked to investigate. And the cycle begins again. The Tulsa case became a symbol of what happens when the most basic rules are ignored and when silence allows neglect to grow unchecked. Though the scandal was centered in Oklahoma, the ripples reached far beyond the state. Other health departments quietly reviewed their own inspection systems. Some began surprise visits to dental clinics. Others increased training for infection control in dental schools. Even the Federal Centers for Disease Control and Prevention cited the case as a reminder of the importance of safe injection practices and standard precautions in every medical setting, no matter how small. For the public, the scandal carried its own harsh lesson. Patients who had always trusted without question began to look more closely. Some started asking dentists how they sterilized instruments. Some demanded to see sealed pouches before tools were opened. The relationship between patient and provider had changed. The blind trust that once defined it had been replaced with cautious skepticism. In a press conference after the scandal, one health official said, "We cannot undo the harm that has been done, but we can learn from it. We can strengthen our systems, and we can ensure that the lessons of Tulsa are not forgotten." It was the kind of statement officials often make, but whether the lessons were truly learned, that remained uncertain. Because the real lesson of Tulsa wasn't just about sterilization logs or expired medications. It was about the fragility of trust. When patients hand their health over to a professional, they assume the system has done its job, that someone has checked, that someone has ensured safety. When that assumption is wrong, the consequences are devastating. Tulsa showed that trust, once broken, cannot simply be patched with regulations and press releases. It takes years, sometimes generations, to restore. The public health lessons of Tulsa were written in inspection reports and policy memos. But the real lesson was written in the lives of those who lined up at testing centers, waiting to learn if their trust had cost them their health. It was a reminder that safety is never automatic. It must be demanded, enforced, and defended every single day. The Tulsa scandal shocked the public because it seemed unthinkable. A dentist's office, a place people visited for routine care, had become a vector for infection. But what many didn't realize was that Tulsa wasn't alone. Incidents like this have happened before, and unless the system changes, they will happen again. In Las Vegas, an outpatient endoscopy center was discovered reusing syringes and single-use vials across multiple patients. The result was the largest healthcare-associated hepatitis C outbreak in U.S. history. Dozens of people were infected. Thousands more had to be notified and tested. And just like Tulsa, it all began with practices that should have been unthinkable in modern medicine. One patient later said, "I trusted them completely. Now I don't trust anyone with a needle." Not all risks come from inside clinics. Sometimes they come from the very drugs that are supposed to heal. In 2007 and 2008, batches of the blood thinner heparin were contaminated with a counterfeit ingredient. The contaminated drug made its way into hospitals across the United States. Dozens of patients died, and hundreds more were harmed. It took months for investigators to trace the problem back to overseas suppliers. But by then, lives had already been lost. The lesson was clear. Even medications themselves can become vectors of harm when oversight fails. In Massachusetts, a compounding pharmacy called the New England Compounding Center shipped contaminated steroid injections across the country. The injections were tainted with fungus. Patients receiving them developed fungal meningitis. More than 60 people died. Hundreds more were left with permanent health damage. Like Tulsa, the scandal began with a facility cutting corners. And like Tulsa, regulators had missed the warning signs for years. Tulsa, Las Vegas, Massachusetts, even nationwide supply chains. The settings were different, but the pattern was the same. Small cracks in oversight. Unsafe practices becoming routine. Silence from staff who feared speaking up. Patients placed in harm's way without ever realizing it. In every case, the public reaction was the same: shock, disbelief, and betrayal. Between 2008 and 2019, the CDC documented more than 60 outbreaks of hepatitis linked to healthcare facilities in the U.S. Most never made national news. Some were small, affecting only a handful of patients. Others were larger, requiring hundreds of notifications. But taken together, they form a quiet epidemic of medical neglect. Outbreaks that should never have happened, yet continue to occur. Many of these stories stay buried in local headlines, academic journals, or government reports. They rarely break into mainstream conversation. And so the public remains unaware of how often medical settings, even routine clinics, can become sources of infection. The Tulsa case forced attention because of its scale. But in truth, it was just one visible part of a much larger problem. The hidden risks in U.S. healthcare are not limited to one city or one dentist. They exist wherever oversight is weak, wherever staff are silenced, and wherever profit or complacency comes before safety. Tulsa was extraordinary in its size, but it was not extraordinary in its cause, and that's what makes it so important to remember. Tulsa was not an isolated scandal. It was part of a larger story, a story of hidden risks scattered across the healthcare system, waiting for the right trigger to come to light. The question is not whether it can happen again. The question is where it will happen next, and whether the lessons of past scandals are strong enough to prevent the next one. When the Tulsa scandal finally came into full view, the obvious question followed. Could this have been prevented? The answer, painful as it is yes. There were countless opportunities along the way, moments when a small action could have stopped a large disaster, but every one of those opportunities was missed. The first line of defense should have been the staff. Assistants, hygienists, and nurses saw the problems daily. They noticed the rust on instruments. They saw syringes reused. They handled sedation they weren't trained for. If staff had been properly trained and more importantly, empowered to speak without fear, the violations might have been stopped years earlier. But in the culture of that office, speaking up meant risking your job. And so silence became the safer choice. In medicine, whistleblowers are often the first to detect danger, but protections for them are limited. If Oklahoma had stronger systems in place to shield staff who reported unsafe practices, someone might have filed a complaint long before infections were confirmed. Instead, fear kept voices quiet, and danger grew in the silence. Perhaps the clearest failure was the lack of routine inspections. Dental offices, unlike hospitals, often operate for decades without a single surprise visit from regulators. If this office had been inspected even once in the years before 2013, the problems would have been obvious. Rust on instruments cannot be hidden. Expired drugs cannot be disguised. Unlicensed sedation cannot be justified. But because inspections were rare, the violations continued unchecked. The misuse of IV sedation was one of the most alarming findings. Unlicensed staff handling powerful drugs, expired emergency kits. It was a disaster waiting to happen. Stronger rules, enforced consistently, could have prevented this. Sedation should have been monitored more closely. Every provider offering it should have faced unannounced checks. In Tulsa, the lack of enforcement turned guidelines into meaningless words on paper. The missing sterilization logs and medication records were another red flag. If regulators had required digital tracking or if pharmacies had flagged irregularities, discrepancies would have surfaced much earlier. Instead, sloppy paperwork covered sloppy practices and no one was watching closely enough to notice. And finally, patients themselves. In healthcare, patients rarely think to ask about infection control. They assume, understandably, that it's handled. But what the Tulsa case revealed is that patients may need to demand more transparency. Sealed sterilization pouches, visible logs, clear answers when they ask questions. It should never fall on patients to police safety. But until systems improve, patient awareness may be the last defense against hidden risks. Looking back, the Tulsa scandal reads like a chain of missed chances. If staff had been trained and protected, they could have spoken sooner. If regulators had inspected, they could have intervened earlier. If sedation rules had been enforced, lives might have been spared from exposure. If patients had been more informed, they might have asked questions that forced change. Each chance was missed. Each silence allowed the danger to grow. And the result was one of the largest patient notifications in U.S. history. The tragedy of Tulsa wasn't just in what happened. It was in what didn't happen. The safeguards that should have worked failed, not because they didn't exist, but because they weren't used. The lesson is simple but heavy. Most medical scandals are preventable. The only question is whether we choose prevention before harm or regret after. The Tulsa dentist scandal was more than a medical investigation. It was a story about trust and what happens when trust is broken. For decades, patients walked through those clinic doors believing they were safe. They believed the instruments were clean. They believed the medications were fresh. They believed the people caring for them were qualified to do so. And for decades, that belief went unchallenged. Until one infection, one test result, forced inspectors to look closer. What they found was not just negligence. It was a system of silence. Staff afraid to speak. Regulators too distant to notice. A dentist who surrendered his license quietly and walked away, leaving thousands to deal with the consequences. Statistics will tell you 7,000 notified, dozens infected, one HIV case confirmed, but numbers don't tell you about the mother who sat in a testing center, holding her child close, afraid of what the results might say. They don't tell you about the man who cried alone in his car after learning he had hepatitis C. They don't tell you about the families that fractured, or the night spent staring at the ceiling, waiting for a phone call that could change everything. Those are the costs hidden behind the charts and graphs. The lessons of Tulsa were written in inspection reports, lawsuits, and policy memos. Train staff, protect whistleblowers, inspect more often, enforce the rules. But the deeper lesson is simpler. Trust is fragile. In medicine, trust is everything. It's what allows a patient to open their mouth to a dentist, or lie still on an operating table, or take a pill prescribed by a stranger in a white coat. Without trust, the entire system crumbles. Statistics will tell you 7,000 notified, dozens infected, one HIV case confirmed, but numbers don't tell you about the mother who sat in a testing center, holding her child close, afraid of what the results might say. They don't tell you about the man who cried alone in his car after learning he had hepatitis C. They don't tell you about the families that fractured, or the night spent staring at the ceiling, waiting for a phone call that could change everything. Those are the costs hidden behind the charts and graphs. The Tulsa case was not unique. It was not the first. It will not be the last. As long as oversight is weak, as long as silence is rewarded, and as long as profit outweighs safety, there will always be another Tulsa waiting in the shadows. The only question is where and when. My name is Rumi Blake. I tell these stories because they remind us that behind every clinic door, behind every hospital wall, there are truths the public rarely sees. I appear in silhouette because this isn't about me. It's about the patients whose voices are too often lost, and the systems that prefer silence over accountability. Medicine is built on trust, and when that trust is broken, the scars last longer than the infection itself. The Tulsa scandal is not just history. It is a warning, and it is up to us, staff, regulators, patients, and professionals alike, to ensure that its lessons are not forgotten. If you found this story important, I invite you to stay with me. I share cases like this, hidden, overlooked, or buried inside medical files, so these lessons are not forgotten. Subscribe to this channel so you'll be here when the next investigation is uncovered, and if you think stories like this need to be heard, share it with someone you trust. Thank you for listening. Stay safe, stay aware, and I'll see you in the next investigation.